everyone, welcome to my channel Dental Edge. I am Dr. Bhanu Chugh, and today I'll be teaching about what is a adenoid cystic carcinoma. Now you must be wondering, why is this image of Tom and Jerry here? You'll relate it later on. Do watch the video till the end to know that how is this connected to adenoid cystic carcinoma. So let's get started. But before that, if you're new to my channel and are interested in dental videos, do consider subscribing it and click the bell icon so you don't miss anything. Now let's get started with today's topic, that is an adenoid cystic carcinoma. Now the first thing that you need to know about adenoid cystic carcinoma, that is, it is a malignant salivary gland tumor. So it's a malignant salivary gland tumor. And there are various reports about its frequency. Some believe that it is the second most common malignant salivary gland tumor. Few believe that it is the fifth most common salivary gland tumor. From this, the question comes that which is the most common malignant salivary gland tumor, and the most common malignant salivary gland tumor is mucoepidermoid carcinoma. And this can be a viva question, that which is the most common malignant salivary gland tumor, and that is a mucoepidermoid carcinoma. Now the adenoid cystic carcinoma, it is slow growing but it is aggressive. It has a high recurrence rate and it is characterized by proliferation of ductal or luminal cells. So we know that we are reading about salivary gland tumor. So there is proliferation of ductal or luminal cells, and there is proliferation of myoepithelial cells. You should know what are myoepithelial cells. If you remember your first year BDS anatomy, myoepithelial cells, these are cells that have characteristic of both epithelial cells, therefore epithelial, and they have the characteristic of smooth muscle cells, therefore myo. So these are specialized cells called as myoepithelial cells. They have contractile proteins, and if I show you the image, these are the myoepithelial cells, right? They are present between the basal lamina and the ductal cells, and they help in contraction of the secretion. So there is proliferation of two cells. There is proliferation of these myoepithelial cells, and there is proliferation of the ductal or luminal cells in varied patterns, that is cribriform pattern, tubular pattern, and solid pattern. This I'll explain you later on. So basically it's a malignant tumor of the salivary gland tissue. It is slow growing, it is aggressive, it has a high recurrence rate, and there is proliferation of luminal or ductal cells and myoepithelial cells in varied patterns. What are these patterns? Cribriform pattern, tubular pattern, and solid pattern, right? Coming to the other names of adenoid cystic carcinoma, so these are the other names. Traditionally, it was called as a cylindroma. Again, this can be a viva question, so you should remember this name, cylindroma. The other names are adenoid cystic carcinoma or adenocystic basal cell carcinoma. So these are the other names of adenoid cystic carcinoma. Coming to the clinical features, the common site are, if we see the major salivary gland, it is parotid, submandibular. So it can be present as parotid gland, submandibular gland. In the minor salivary glands, the common site are palate and tongue. So remember these sites. Coming to the age, remember this image, right? It is common in 5th and 6th decade of life, that is little bit older age, and it is more common in females. So remember this image for remembering the age and the sex of the patient. So common sites are parotid, submandibular gland. In the minor salivary gland, the common site is palate and tongue, and the age is 5th to 6th decade, and it is usually seen in females. Since it is a malignant salivary gland tumor, it shows features of a malignancy. So there will be early local pain, facial nerve paralysis in case of parotid tumors, fixation to deeper structures. There will be local invasion, Intraoral lesions, they may show surface ulceration. That is, for example, if the lesion is in the palate or the tongue, it may show surface ulceration. And one of the most important points, and it can also be asked in viva, is it has a marked tendency to spread through perineural spaces. So adenoid cystic carcinoma has a tendency to spread through perineural spaces, and therefore it can spread to the surrounding structures easily, and it usually invade well beyond clinically apparent borders. Remember this thing, that where do you see perineural invasion? So adenoid cystic carcinoma has a tendency to spread through perineural spaces. Now let's see the histopathologic features of an adenoid cystic carcinoma. So it is composed of myoepithelial and ductal cells in a varied arrangement. I already told you there is proliferation of ductal or luminal cells and the myoepithelial cells, right? So two types of cells are there in varied arrangement. What are these arrangements? You have to remember this: cribriform, tubular or solid arrangement. How will you remember this? CTS. If you find this easy, remember this: CTS, cribriform, tubular and solid. These are the three patterns in which you will see. Or you can remember, if you find this easy, cute t-shirt, right? For C stands cribriform, for T stands tubular, for S stands solid. Whatever you feel comfortable, you can remember is CTS or cute t-shirt. Cribriform, tubular, solid. In this, the most important is the cribriform pattern. It is a classic pattern of adenoid cystic carcinoma and it is the most common pattern. And let's see in detail what is a cribriform pattern, which is a classic or the most common pattern. Now, as I told you, cribriform, it is the classic, most common, best recognized. Why is it called as a cribriform pattern? The word cribriform means something that has perforations, something that has holes, right? Perforation or holes. This is the meaning of the word cribriform. If you remember first year anatomy, there was a cribriform plate, that is a plate with presence of holes. Therefore, it was called as a cribriform plate. When we studied skull in anatomy, you must remember, you must have read about this, right? So, in adenoid cystic carcinoma, there is presence of basaloid epithelial cell nest that form multiple cylindrical cyst-like patterns. So, if you can appreciate, these are the tumor cells. These are nest of tumor cells. These are all tumor cells, and between this, there is presence of multiple cyst-like structures. Cyst, another cyst. Can you appreciate? So there are tumor cells, there are basaloid epithelial cell nest, basaloid epithelial tumor cell nest, and in between them there is presence of multiple cylindrical cyst-like patterns. So cribriform means presence of holes or perforation. When you see a slide of adenoid cystic carcinoma, you can appreciate small cyst-like structures, multiple cylindrical cyst patterns are there. So because of these small cysts, it appears like holes, and therefore it is called as cribriform. This is point number 1. The next point is, it also resembles Swiss cheese, and this is the reason I told you that you should remember that Tom and Jerry image. If you can appreciate here, you would have appreciated that Swiss cheese in Tom and Jerry. There is Swiss cheese pattern. This is a Swiss cheese. You can see on the image, this is Swiss cheese. So remember Tom and Jerry for adenoid cystic carcinoma, and you remember that Swiss cheese pattern is seen in adenoid cystic carcinoma. These all are tumor cells, and these are cyst-like small cyst spaces, cystic spaces. This is surrounding it is the tumor cells. So this pattern overall resembles a Swiss cheese. Therefore, this is a very important question. Where do you see Swiss cheese pattern? And it is seen in adenoid cystic carcinoma. And it can also be said to be a honeycomb pattern because of these small cyst-like pattern. Then next is lumina of these spaces. These are the spaces. It is a little zoomed image. These spaces, these cyst-like spaces, the lumina of these spaces contain pars positive mucosaccharide secretion. Correct? So what all we learned in the cribriform pattern? Cribriform pattern is the classic pattern. It is the most common pattern and it is the most easily recognized pattern. Cribriform means presence of perforation or holes. The word cribriform means this. Now why is it called as this cribriform? Because in this there is presence of multiple cylindrical cysts in between basaloid epithelial cell nest, and therefore it is called as cribriform pattern, or therefore it is also called as the therefore it is also called as the Swiss cheese pattern. Can you appreciate these small cystic structures? So therefore it is also called as Swiss cheese pattern. Very important Viva or MCQ question, or honeycomb pattern it can also be said. Last is lumina of these spaces contain pars positive mucopolysaccharide secretions. Coming to the next, that is the tubular pattern. Tubule means relating to tubule or in a tubular shape it is. Tubular structures that are lined by stratified cuboidal epithelium are there. And the last is the solid pattern. In this, solid groups of cuboidal cells with little tendency towards duct or cyst formation. Now remember that solid pattern, this, if you see this, it is a high grade lesion. It has high recurrence rate. The prognosis is very poor for the solid one. So the most common is cribriform, and the most aggressive or the one with the worst prognosis or highest recurrence is the solid pattern. So high grade lesion, recurrence rate is 100%. That is 100% it will recur, compared with 50 to 80% in the tubular or cribriform pattern. And the histologic subtyping is done on the basis of which pattern is most prominently present. Coming to the treatment and prognosis, surgical excision is treatment of choice. Sometimes surgery is coupled with radiation. Tumor, it grows slow, but it is aggressive since it grows through the perineural spaces and it metastasizes late. So tumor grows slow and metastasizes late. Factors influencing prognosis are site. Prognosis is better for the tumors that are present in major salivary gland than the one that are present in the minor salivary gland. And histologic pattern, as I told you, solid pattern has the worst prognosis. The recurrence rate is high and it is very aggressive, the solid pattern one. So we are done with the topic. And to summarize, adenoid cystic carcinoma, it is a malignant epithelial salivary gland tumor. It has high recurrence rate. It is slow growing but aggressive. There is proliferation of ductal or luminal and myoepithelial cells in 3 patterns. Varied patterns, but there are 3 patterns: cribriform, tubular and solid pattern. Clinical features, it shows features of a malignant neoplasm, that is there is early local pain is there, it is fixed to underlying structures. Then it is more common in females, age is 5th to 6th decade. Site in major salivary glands, it is parotid, and submandibular gland. In minor salivary glands, the site is palate and tongue. Coming to the other names, you should remember the other name cylindroma. And then coming to histopathology, there are 3 patterns. Cribriform is the most common, best recognized, and it is the classic pattern. Why is it called as cribriform? Because there is presence of multiple small cyst-like structures in the tumor cells, in between the tumor cells, and it resembles like there is perforation. So cribriform pattern. Then one of the most commonly asked question, where do you see Swiss cheese pattern? So since there is presence of these small cylindrical structures that resemble Swiss cheese, the holes that are present in Swiss cheese, therefore it is also called as Swiss cheese pattern. For this I told you, remember Tom and Jerry. So adenoid cystic carcinoma, remember the image of Tom and Jerry and the Swiss cheese, right? Then coming to the tubular pattern, the cells are arranged in tubular structure. Then solid pattern, solid sheets are solid arrangement of cells is there, and solid has the worst prognosis. Treatment of choice is surgical excision. These are my references. My main reference is Sheffers. This is the book that I recommend to all BDS students. And thanks for watching. It takes lots of effort to make such videos. Your one like can give me lots of encouragement. So do like the video, subscribe to my channel. I also have a WhatsApp group. The number for the same I'll mention on the screen. For any query, you can join that group. And thanks for watching.